The DIEP flap surgery, or the DIEP flap surgery, is one of the most advanced types of natural tissue breast reconstruction that we do for women at the time of mastectomy, or for women who've had mastectomy in the past and reconstruction with implants or no reconstruction, and now want to change their reconstruction for natural tissue. The DIEP flap surgery involves transplanting your own tissue, your own skin and fat from your belly to reconstruct the breasts, and you end up with a natural looking breast that feels like a natural breast, it looks like a natural breast, it moves like a natural breast, and most importantly, it lasts for the rest of your life. And on top of that, you get a nice flat belly, kind of like a tummy tuck at the same time. Many women are good candidates for DIEP flap surgery if they're undergoing mastectomy, removal of the breasts, or if they've had mastectomy in the past with a breast implant reconstruction and now want to remove the breast implants and replace it with their own natural tissue. The benefit of the DIEP flap surgery is that not only do you get a natural looking breast reconstruction that lasts forever, but you also get a flat belly at the same time. Some patients are too thin to transplant tissue from their lower belly, and if those patients want to have natural tissue reconstruction, we can offer them other surgeries where we can transplant tissue from another part of their body, like their buttocks or their thigh, and those operations are called the PAP flap or the gap flap, the tug flap. All of those surgeries involve transplanting natural tissue and reconstructing a breast with your body's own tissue. The alternative to using your own tissue is to use a breast implant, and we offer all of those surgeries because we specialize in breast reconstruction. It's not very invasive surgery. We're not operating on your heart, your lungs, your organs. It's just the skin from your belly and your breasts. You'll be up and walking on the very first day after surgery. We'd like to keep you in the hospital for 1 or 2 or 3 nights and then send you home. The recovery is about 3 to 5 weeks after surgery. It doesn't mean that you're in bed for 3 weeks. You're going to be up and walking. And by the time you come back to our office 2 weeks later, we take out the surgical drains. You're back to your normal routine after about 3 or 4 weeks.